Hi everyone, my name is Marlaena Gunther and I am a registered midwife, currently non-practicing on my own mat leave right now. And I have worked for Southern Health over the last year and a bit, as a midwife here in Steinbach. And I was asked to talk to you a little bit about kind of the role of the midwife, so I'm going to talk about that, what we do, and then as well as a few ways that you can enjoy some of the benefits of midwifery care if you don't have a midwife yourself. So first off, midwife means with women. So often I've heard the joke, oh, what are male midwives called? Because there are a few in Canada, and we even have one in Brandon. Should they be called mid-husbands? Well, no, because it's Latin. I think it's Latin for with women. Worldwide, there's more than 80% of babies that are born with a midwife, and that's an older stat, so it might even be more at this point. Fortunately, not nearly as much in Canada, and certainly not here in Manitoba. Midwives here in Manitoba, for sure, must be properly trained through an accredited school. They must be licensed and then registered with the college of that province that they're in order to work and provide safe care for women. So it can't just be anybody. People can't just call themselves a midwife. They have to be registered with the college, and that proves that they've had proper training. So what a midwife is or does, we're trained specialists in caring for women throughout pregnancy, during labor and delivery, and then up to 6 weeks postpartum for both the mom and the baby. So we are primary care providers, which means that we have full responsibility for the care of both mom and baby. We're not supervised by a doctor, we're not supervised by an OB, and as long as there aren't any complications, there wouldn't be any reason for you to go and actually see a doctor throughout this whole pregnancy, postpartum, up to 6 weeks journey. So essentially, when you find yourself pregnant, you can choose between having a doctor, having a midwife. There's no cost to having a midwife here in the province. It is covered by Manitoba Health. Unfortunately, we just don't have enough midwives to be able to accept everybody. So midwives are allowed to prescribe a number of medications relating to childbearing, labor and delivery. We can order and interpret different lab or diagnostic tests. So we can do the blood work here in our office. We can order blood work. We can order ultrasounds. We can prescribe medication for UTI, things like that. And we can also perform a few minor surgical or invasive procedures. So some of those might include like doing stitches. We can do first or second degree stitches. Some midwives do have specializations, allowing them to participate in some things like inserting IUDs, maybe STI screening, pap smears for non-midwifery clients, fertility, well baby care, things like that throughout the childbearing years, immunizations, all of that. In Manitoba, a few people are able to insert IUDs. There might be a few other ones, but typically all those other things I mentioned are considered out of scope for the midwives in Manitoba. Midwives and really any care provider should be operating from an evidence-based practice, which means that we are expected to be up to date on the latest research behind what is safe and recommended to be able to provide you with the best care. So a common, misconception is that midwives only deliver at home. While we love home birth and we do many home births, midwives can deliver at home, at the hospital, whichever one they have privileges in. And then if you happen to live within the WRHA, then you are able to also deliver at the birth center. There has to always be two care providers for a birth. So one that focuses on mom and then one that focuses on the baby. And so at a home birth, we have two midwives. At a hospital birth here in Manitoba, and this is different in other provinces, but in Manitoba, there would be a midwife and then a labor and delivery nurse that would help. there. In terms of clinic, this varies completely depending on the group that you're in. Usually midwives are set up in practice groups of maybe 2 to 4 or pods. So they might share call time, and that means that when you call in, we would get a midwife from that team. It may not be your main one, and so usually then all the midwives in the group would try and see you at some point in your pregnancy. So you know who they are and they know who you are. And then some groups will share clients equally. Others will generally only see the people that are in their primary care, and then see their colleagues' clients just a few times. That way they're somewhat familiar with them. And that would be kind of a case of primary care or shared care within the team. Visits are also very dependent on the clinic and the midwife, really. Some will have visits scheduled for a half-hour appointment, some 45, some for an hour. We also try and fit in our paperwork in there as well. And there's a lot. This extra time helps us to build a relationship with you, get to know you, you get to know us, and then we also can answer in more detail the questions that you might have. So here in Steinbach, things are changing constantly, but currently there are 7 midwives. They work in 2 pods and mostly follow a primary care shared call model. So midwives are, we consider pregnancy and birth a normal part of a woman's life, something that impacts both her and her family many ways. We care for the women then as a whole. We take care of the physical side, but also that social, emotional, and spiritual side. And then if there is a point where we do need to refer to somebody else, then we do that. So so that being said, so we are considered kind of experts in normal, but we are trained to recognize when there are complications or difficulties, and then we act in such a way to prevent negative outcomes. And sometimes that means we need to get help more than what we can give. So we're trained to know when to get that help and how to respond to common emergencies if no help is immediately available. And so in that, some cases are just, they come up and they're complications that we just need to get them to the hospital, or we need to get the doctor to come in. There are certain situations that might pop up where our college actually requires midwives to consult or transfer care. That might be to a family doctor, it might be to an OB, it might be consulting fetal assessment in Winnipeg, a dietitian, a mental health counselor, all these different things might pop up, whichever is most relevant. This guideline was actually just changed, so the midwives in Manitoba actually, we don't have to consult for as many things. It gives us a little bit more freedom, which is nice. So just because you might be transferred to a different care provider, it doesn't mean that you're gone, kind of gone from midwifery care forever. Usually it's a case where we're consulting or transferring care just for one thing. So maybe we are consulting or transferring care to a doctor for a baby's tongue tie to be released. They come right back to us. Depending on privileges, so some of the midwives, most of the midwives here in Steinbach actually don't have privileges for certain inductions. We don't for any C-sections, and often, depending on the doctor, but as soon as kind of baby's out and things are good, then the care is transferred back to us. That would be in a case of an induction. Obviously with the C-section, there's a little bit more recovery and stuff too that takes place. So the baby, as long as the baby is okay the whole time, that baby technically doesn't ever leave our care. So for example, like a breech C-section, baby's fine, they just are choosing C-section as a mode of delivery. baby would stick with us and mom would just stay in the care of the doctor until they're discharged from the hospital, and then we get them for the rest of the 6 weeks. So we don't let go of our ladies and babies too easily. Some of the conditions do actually require us to transfer care fully. There may be something that comes up that is just really outside of our scope, our expertise, and so as much as we love to keep our clients, we really want them to have the best care, and so they might be transferred fully to an obstetrician or a family doctor. So for example, if a woman has gestational diabetes and then is required to be on insulin, they have to deliver in the city, and usually we would transfer care later in the pregnancy. If they have placenta previa, same thing, or maybe they have a significant medical condition. So a few of the benefits of midwifery, and this is just a very short list, there's plenty of other ones, but some of the positive maternal outcomes would be a reduction in epidural use, a reduction in episiotomies, a reduction in inductions. There would be a lowered C-section rate in stomach. It's actually very good. There's also increased access to prenatal care. We are able to, and usually this is more postpartum, but we are able to come to the home. There's also higher rates of breastfeeding in this initiation, and shorter hospital stays. Newborn outcomes are also very similar or better with midwifery care. There's less prematurity, lower need for resuscitation, and better APGAR scores. And part of this is that we only do low-risk clients, but in that just the more in-depth care that we can provide, longer visits, things like that can help with that. So unfortunately, not everyone that wants a midwife can get one. There just aren't enough midwives in the province. So if you have a chance to advocate for us, that they're, tell your MLA that we need more midwives, please do. There aren't enough to meet the current demand. And so there are so many great benefits to having a midwife. We can provide a very satisfying birth experience, but not all is lost. If you want to have a good experience and you don't have a midwife, there are plenty of ways that you can help create that experience for yourself. So these are just a few things. There are so many other things that you can do as well, but I'm just mentioning a few of them. So one is to hire a doula. Like I said, I'm on a mat leave with my first baby, and I did hire a doula. It is something that you have to pay for out of pocket. I do consider it well worth it as long as you do feel comfortable with the doula that you have. Feel free to interview several if you need to find one that works for you and that's you feel comfortable with. Another thing, midwives are not doulas and doulas are not midwives, although we both work with labor delivery. Doulas are not allowed to do anything medical, but they are a great source of information. Some doulas have a lot more backing, and they have, I believe, certifications and things like that they go through, but try and back up some of the information with your own research or by asking your doctor as well, just to make sure that they're not just saying things, I guess, that aren't true. But doulas can really provide great labor support, hands-on massage, counter pressure, heat, oils, music, all sorts of things. They can really advocate for you as well. If there's a situation where the doctors or nurses are maybe pressuring you to do something that you are feeling really uncomfortable with, they can help you, or they can even just be that voice of sharing what your birth plan is when you're in the midst of contractions and don't even think of what your plan was. You know what it is, but they can really help with that. And some will even provide some prenatal teaching or postpartum support as well. It just depends on the doula. Maybe you should have a doula here for some of these classes, and they can share more information. So the second big thing, and you should do this even if you have a midwife. You should not just blanket trust your care provider. But that is, do your research, do your own research. It does take extra work, but in doing some personal research, it could be in the form of books, articles, videos, watching somebody on YouTube or Instagram or whatever, even others' experiences. You can really learn a lot. I will say though, you have to be very careful that the source of the information that you are getting is accurate, whether it's somebody that is certified or trained, let's say on Instagram, or they are like an experienced labor and delivery nurse, or they're a doctor. Some people, blogs, whatnot, there can be a lot of untrue and misleading information, and that can make our job difficult as well. So do your research, but please try and use good sources. You can use Google Scholar. You can look up SOGC, stands for Society of Obstetricians and Gynecologists of Canada. That's our governing body for everything kind of labor and delivery. And that would be a good resource as well. Looking up the college website. So we have the College of Midwives of Manitoba, or CMM, the Association of Ontario Midwives is also a really great resource because they have a lot more years of experience, a lot more money for research and things like that, and they have some great articles with really solid research. So I would recommend looking that up, the Association of Ontario Midwives, or AOM. Okay, so another major component of midwifery care is informed choice. If you haven't heard of that before, basically what that means is that whoever is kind of giving you this informed choice, we are presenting you with the information on whatever it is, so a test, just a certain subject, a screen, a form of laboring, a medication that we might give, anything really. And you take that information and you decide what's best for you based on your values, your experiences, yeah, what's important to you. So we would give you a description of what it is, why are we doing it, what are the benefits of doing this test, what are the risks of doing the test, and also what are the might be the benefits or risks of not doing that test, whatever screen. Some alternative options, and what are any recommendations that might be out there. So for example, the SOGC sets out certain standards and recommendations for the entire country. So we would give those to you, as well as if there are any recommendations based on your own history that might pop up. Even if something is recommended, you are still able to choose a different option, and we would try our best to support you in whatever way that might look like. That being said, some choices do go very much against our own scope, of our own skill level, or something that goes very much against what we know to be safe. Depending on how risky it is, we really try to support you in your choice. Sometimes there are just situations where we would discontinue our care and then transfer you to somebody else, but that really doesn't happen very often. So whether you have a midwife or not, all providers should be giving you informed choice. This includes for labor and delivery as well. Some doctors, they're very busy. They typically don't have the time to tell you all about those things. They will often just get you to do a test, do a screen. They'll give you the lab rec, go do this. That's where having us midwives, we have more time to spend with you, and so because we don't have nearly the clients or patients, I guess, that doctors have, so we can talk to you through all of that. So this is really where doing your own research can help. That way, if you do have any questions, you can have a more directed conversation with the doctor about them, and as well, you can already know some of the information and decide what you would value doing, or maybe what you would value not doing, what may not be right for you. And it's true, not all tests, screens, or medication might be right for you, and that's where, yeah, that research is great. One thing that I will say about this topic is that there are a number of things that can be declined without too much issue. There are some that really are very important to do, and so you may encounter more resistance to a choice to decline those things, especially, and that's regardless of care provider. So there are a few things that even as midwives, we get you to sign a waiver form if you're choosing to decline them, just because the chances of something bad happening or the outcome might be very, very, very serious should it happen. And we really want to make sure that you know what you're deciding. So with that, really want you, when making decisions, especially ones that go against the current recommendations, that you make those decisions from an educated standpoint, whether that's from your own research, from what your doctor or your midwife is telling you. It should be your decision. It should not be something you're deciding, yeah, again, especially if you're choosing to decline something because that's what your mom says that you should do, or maybe your sister declined it so you're going to, or declining something just because you are finally able to make decisions and you're just choosing to decline stuff. You need to be very much okay with your decision and as well the outcome of that decision. Whether that is a good outcome or a bad outcome, it needs to be your decision. That could be extremely hard to be okay with if it was a choice that you didn't really make. It was something that just, you made based on whatever somebody else did or what somebody else told you to do, but you didn't really feel that great or you didn't make that decision. Kind of switching gears over to the labor side of things, go with the flow, super important. We can have birth plans. The form that we give out, and I believe the doctors do as well, it says birth wishes, which I like because if you have a plan that's too set in stone for your labor, you might be set up for disappointment. Birth doesn't always go according to plan, whether that's kind of it goes worse or even better. It just might not happen the way you think it will. Very often that's the case. So by being flexible, going with the flow, you can have a plan or wishes, but be okay if that's not the way that things go. If you're more relaxed about it, not so uptight that things may be not going the way you want them to, then a more relaxed body helps manage pain better. And when pain is managed better and you're more relaxed, your body can do what it needs to do, and generally then the labor happens or goes by better. So a great way to be more relaxed is with your breath. So practice breathing ahead of time. You can do meditation. There are plenty of apps or YouTube videos out there. There could be a guided class. A doula might teach you how to do proper breathing. Even pelvic floor physio is a great way. I did that with my own my pregnancy, and the person taught me how to breathe through and how to push properly. And so those are things that you can practice ahead of time. So you don't have to just go to labor and wing it and then find that you aren't able to cope as well. That way, when you are in labor, if you practice this ahead of time, it'll just be second nature to you, and you don't have to really focus on trying to breathe. It'll just come more naturally. And that way too, because we have a very busy hospital unit here, the nurse might not be able to be with you the whole time and help you breathe and show you how to do it. And so if you've already done this ahead of time and you know what to do, your partner can also know what to do, and they can help you through that as well. And then just the last point I have here is about movement. So movement is huge to getting the baby out. Moving down the birth canal and then as well coping with the pain of labor. So typically what we see on TV, a woman on her back the whole time, not moving at all. If this is the position that works best for you and you feel comfortable, you feel great, awesome. But I don't want you to settle for that just because that's what you've seen and that's what you think labor should be like. So I would really encourage you to move around until you feel a position. Find the position that feels the best for you. Obviously, you're in labor, contractions suck, but there can be some positions that can really help you to manage that pain. And you might have to try a few things. So maybe stand and sway. You can kind of be supported on a dresser or the bed or something, your partner. Try that for a few contractions. If that's not working for you, stop. Try something else. Maybe go onto your hands and knees. Maybe lean over a birth ball. Try a supported squat. You can even try laboring on your side. That can be a really nice one too when you're tired, but you don't want to be on your back. If it doesn't seem to help after a few contractions, it's good to try something else. And that movement helps baby to kind of twist through, move through that birth canal as well, as opposed to just being on your back and having them have to try and push upward against gravity and then against that tailbone. You might have to be a little bit creative with this if you are in the situation where you need to be strapped to the electronic fetal monitor to listen to the baby. It can be done. That's why I say you just have to be a bit creative. You also may need to advocate for yourself if a nurse tells you it can't be done, because usually it can be done. The position might need to be slightly different, or maybe they need to use like some towels or something to put more pressure up against to be able to actually track it, but it usually can be done. But you can't have as much freedom of movement. But being on the ball, edge of the bed, usually these things can even happen. You can even move with an epidural a little bit. There are a little bit more limitations though, in that you don't want the epidural to wear off in certain areas, but usually some movement can be accommodated, and actually is really important, as usually with an epidural we are just lying in our beds on our backs, and that way there isn't as much movement for baby to wiggle through as well. So yeah, so that is just a few of the examples to help your labor be a little bit more in line with also how midwives would take care of you. Doesn't matter if you have a midwife or a doctor. Really, anything that you can do to help your labor experience be better is also one that's a bit more empowering. And that's just what I want to share with you with all of this. Again, regardless of care provider, I want your experience to be one where you feel empowered, where you feel like you have made the decisions that are right for you, and you are able to move in the way that feels right to you in labor, and especially in this situation now with COVID, while I'm filming this, that it may feel like a lot of choices are taken away from you. And so I want to really encourage you that there are ways, little ways maybe, but there are ways that you can provide, I guess, for yourself a good experience, and really feel coming out of it, I guess, that yeah, your experience was a good one, and one that you didn't feel was just forced on you. So yeah, again, if you have any questions about midwifery, you can just Google College of Midwives of Manitoba. There are a lot of great things on there, including some of our standards, our framework, code of ethics, things like that. And like I said as well, a really good resource for you is the Association of Ontario Midwives. They have lots of great things even about like home birth versus hospital birth, a lot of the different standards for the tests and screens that you might encounter, that your doctor might tell you about. That would be another great resource. And then I guess a more scientific, no, that's not true. A more, I guess, scientific sounding maybe would be the SOGC, so Society of Obstetricians and Gynecologists of Canada. That would be another one to look into. So thank you for listening to this. Feel free if you have any questions. You can ask them to me now in this presentation if I'm there with you, or you can pass them along to those at the resource center, and they can pass them along to me, and I might be able to answer them. Hopefully you enjoyed this presentation video in these strange times. Everything's online, but if you have a midwife, hope you enjoy your experience. And if you don't, I hope you also enjoy your experience, because it doesn't really matter. This is your experience, and wish you all the best. Bye.